Herbs that relieve cough and wheezing. Herbs in this category treat the branch, which in this case is cough and wheezing. When lung qi is either too weak or if there's not enough fluids in the lungs, like with dryness or yin deficiency. When there is too much fluids in the lungs, like if there's damp or phlegm accumulation. Or if there's an excess pathogen, like wind cold, wind heat, but also damp phlegm accumulation or even qi stagnation, lung won't be able to downbear or disperse its qi. This causes lung qi to reverse, and there's cough and wheezing. Cough is always due to qi reversal, and qi reversal is always a branch pattern. So what's the root? Well, there can be quite a few different causes for qi reversal. Coughs can be caused by an external invasion. They can be caused by qi deficiency. They can be caused by yang deficiency or even yin deficiency. If there's damp phlegm accumulation or qi stagnation, this will also lead to qi reversal. These herbs mostly treat a cough due to exterior invasion, internal deficiency, heat or cold. You can combine these herbs with herbs that release the exterior for an external contracted cough, herbs that tonify qi or herbs that tonify yin, herbs that warm the interior or herbs that tonify yang for coughs due to cold, and herbs that clear heat for coughs due to heat. Herbs in this category have three main functions. First, they're going to ventilate the lungs to remove the phlegm. So they're going to get the lung qi flowing and moving again. They're going to moisten the lungs to stop cough, especially if coughs are due to more of a yin deficiency or a dryness or due to heat. This will injure fluids or is caused by fluids that are injured. And then last of all, these herbs will direct rebellious qi downwards, which will stop coughing and wheezing. The main taste is bitter or acrid. The exception is Bai Bu, which is sweet. The main temperature is warm, with the exceptions of Pa Ye, which is neutral, Bai Bu, which is cold, Zi, which is very cold. The main channel is lung. The main symptoms are cough and wheezing. The main tongue and pulse, well, it's going to depend on the underlying condition. The main contraindications, well, this is also going to depend on what is the cause of the cough and wheezing. While all these herbs treat cough and wheezing, each is used for a very specific type of cough and wheezing, and we're going to look at that when we look at the herbs, and we'll do a good review of it at the end of this category as well. The first herb is Xing. This is apricot kernel. Xing, or Ku Xing, as it's also called, is bitter, and it has a descending nature. It's slightly warm, it's slightly toxic, and it goes to the lung and large intestine. Its flavor is bitter, it's going to drain downwards, and it's essential to stop cough and wheezing. It's one of the most important herbs we have to stop cough and wheezing. Depending on the herbs it's combined with, Xing can treat all types of cough and shortness of breath, but really on its own, it's good for two types of cough. Xing is good for externally contracted coughs due to exterior invasions, or coughs with wheezing. That's not listed here. The herbs in this category are best categorized by the types of cough they treat. I'll go through these individually and then cover them together in the review at the end of this video. Xing is often combined with Zhi, which is an herb we looked at in the transformed cold phlegm category. They're often used together to treat coughs. Zhi opens and helps the lung qi to move and circulate while transforming phlegm. This gives it the ability to guide the actions of the other herbs in the formula to the lungs and the throat. Xing has more of a downward action, and it's used to stop the cough and wheezing. You can also combine Xing with Huangqin, Gualo, Bai Bu for coughs due to chronic lung heat. Xing is a very oily herb. It's used to moisten the intestines and treat constipation. There are two types of Xing. There's Ku Xing, which is more bitter in quality and better at descending qi, and that's the one we're looking at now. And then there's Tian Xing, which is more moistening in quality and better at moistening the lungs. Note the contraindications and cautions here. It's contraindicated in yin deficiency coughs or general debility. It's better at treating external type coughs. It's cautioned in infants and in cases of diarrhea because it is slightly toxic. This herb contains the toxin cyanogenic glycoside, and it's advised not to go over the recommended dose of 3 to 9 grams. Adverse reactions have happened when 40 to 60 kernels have been ingested by adults, or just 10 to 20 in children. A mild overdose may produce dizziness, weakness, nausea, vomiting, abdominal pain, burning sensations in the upper abdominal region, increased blood pressure, and also increased respiration. Severe overdose of Xing can cause slow, shallow respiration, coma, convulsions, pupil dilation, decreased blood pressure, and possible respiratory or cardiac collapse. For overdose, you can use the bark of the apricot plant, Xing Shu Pi. Cook 60 grams in 300 milliliters of water for 20 minutes. Or you can use guizhi 9 grams, wu yao 9 grams, chuxiao 9 grams, honghua 15 grams, and you take this decoction 2 times daily. Zi is acrid, bitter, and slightly warm. It only goes to the lung channel. It warms without drying, which is very unusual for an herb with these properties. Zi goes to the lung channel. It's acrid in nature and enters the qi of the lung channel. It's red in color, and so it can enter the blood of the lung channel as well. We don't really talk about lung blood, but that is more because there's not a pathological pattern called lung blood stasis or lung blood deficiency. All organs have both qi and blood aspects, yin and yang aspects. Zi enters both the blood and qi aspects of the lung channel. In this way, it moves qi and blood, it moves lung qi downwards, and it can also moisten dryness, and at the same time dissolve phlegm. In this way, it stops cough. It's best for chronic coughs due to internal injury, and also coughs due to lung qi obstruction, which usually happens post-wind cold, where the lung qi is stagnated with coughing, wheezing, and profuse sputum. So to recap, the types of cough that Zi treats: cold-induced cough, because it's warming in nature; post-wind cold coughs with stagnant lung qi, with coughing and wheezing and profuse sputum. It also moistens dryness and dissolves phlegm as well. Kuan is acrid and warm, and it also goes just to the lung channel. It moistens the lungs, it directs qi downwards, it stops cough and transforms phlegm. It's used for cough and wheezing from many different types of etiologies, but what Bensky says is that it's best for coughs due to externally contracted disorders, just like Xing. And it's very good at moistening, so it's more effective for dry coughs. Zi and Kuan are often used together. Both herbs will warm and moisten, and they both treat cold-type cough with profuse sputum, or they can both treat a chronic cough with blood-streaked sputum because they are moistening. Of the two, Kuan is better at relieving cough. Then we have Zi or Sutza. Sutza is acrid and warm as well. It goes to the large intestine and lungs, so it's similar to Xing. Like Xing, it's going to stop cough and calm wheezing. It's good at directing qi downwards. It will help to dissolve phlegm because it's acrid and will get qi moving again. It's best used for coughs with the stifling sensation in the chest. And like Zi, it's best for cold-induced coughs. Because it goes to the large intestine, it will moisten the intestines, and it will help with constipation due to dry intestines. It's a seed, and as most seeds, they tend to be oily in nature. They're like little packets of pure yin, and yin, of course, is going to be oily. Pa Ye is bitter and neutral. It's the only neutral herb we have. It goes to the lung and also the stomach. Pa Ye transforms phlegm, it clears lung heat, and it moves qi downwards to stop coughing and wheezing. It's best used for dry types of coughs because it moistens the lungs as well as dissolving phlegm. Because it goes to the stomach channel, it will help to harmonize the stomach, and it's used to descend stomach qi downwards. So it's used for symptoms like nausea, vomiting, hiccups, and belching. From this category, it's one of the best herbs to use for sticky, difficult to expectorate sputum. Then we have Bai Bu. Bai Bu is sweet and bitter and slightly warm. It goes to the lung channel. Because it's sweet and warm, it's good at building fluids, and it's best for chronic cough due to internal injury. It will both moisten the lungs and it will stop coughing. You can use it actually for both acute and chronic type coughs. Its unusual function is Bai Bu will treat parasites. It kills lice and body lice. It can treat fleas and bacterial vaginosis. And you can use it as an enema at night for pinworms. For this function, it's used topically or as an enema. Okay, let's look at the contraindications. Bai Bu, because it's bitter, is contraindicated for spleen deficiency with loose stools. Sweet and cold sung by Pi goes to the lung channel. It drains lung heat and it stops cough and calms wheezing. It's best at regulating the water passages in the body. It treats phlegm accumulation, but it's also very good at treating cough with edema. So you're thinking like wind-water invasion, where you have a fluid accumulation in the upper jiao. When this happens, usually, the lungs aren't able to disperse and descend, which affects the urinary bladder's ability to disperse and descend urine. This leads to urine accumulation in the lower jiao. So Sung Bai Pi not only regulates water in the lungs, but it will also regulate fluids in the UB as well. Its function for clearing lung heat is actually quite mild. Just make note of that. And then in its third indication, it treats hypertension, probably because it helps to regulate fluids and it works like a diuretic, right? It's going to promote urination. So it has that same function that we see diuretics have, and that's how it treats hypertension. It's not a powerhouse herb for this indication. Sung Bai Pi is actually contraindicated for cough or wheezing from lung cold. It's better for lung heat, and it's better for like wind-water invasion. So you really need that fluid accumulation for this herb. You would combine Sung Bai Pi with Bai Qian for chronic productive cough. Sung Bai Pi will drain heat from the lungs and fluids, and Bai Qian will redirect lung qi downwards, and it will help to dissolve or transform phlegm. The next herb is Ting Zi. It's acrid and bitter and very cold. It goes to the lung and the bladder. So lung disperses and descends qi down to the kidneys. It sends excess fluids along with its qi down to the kidneys. The kidneys process the fluids and send them out through the UB. So like Sung Bai Pi, Tilingza is good at regulating the water passages in the body. They both sedate the lungs to regulate the water passages. In this way, they both treat phlegm. Tilingza not only reduces phlegm and calms wheezing, for excess type wheezing or cough, where there's copious sputum or a gurgling sound in the throat, but it also moves water. So it's very good at treating facial edema, fluid accumulation in the chest or in the abdomen, especially if there's urinary difficulty with it. And we're talking about like an excess type lung or UB qi obstruction issue, which is what we usually see when there is an excess exterior invasion like wind-water invasion. This herb is really good to treat coughs with copious thick sputum, and it should not be used for coughs from deficiency. So when we talk about fluid accumulation, we're talking about excess type fluid accumulation, not like a yang deficiency or qi deficiency type fluid accumulation. So Tilingza and Sung Bai Pi both sedate the lungs to stop shortness of breath, wheezing and cough, and they promote urination and reduce swelling. Of the two, Sung Bai Pi clears lungs more strongly, and Ting Liza sedates water in the lungs more effectively. Okay, let's review. So these herbs can be divided into two categories. You have herbs that arrest cough or stop cough, and those are Xingren, Bai Bu, Zawan, Kuan, Sutsa, Pa Ye. Then we have our second group that sedates the lungs, stop coughs, promotes urination, reduces swelling, and by swelling, it's water swelling. You have Sung Bai Pi, which clears the lungs more strongly, and then you have Ting Liza, which sedates water in the lungs more effectively. So the two herbs we have for externally contracted disorders, or the best two that we have, are Xingren and Kuan. Bai Bu and Zawan are better for chronic coughs due to internal injury. Zawan and Zisuye are good for cold-induced coughs, while Sung Bai Pi is best for heat-induced coughs, although it's not very strong with this function. Pa Ye is better for dry coughs, and Xingren is best for all types of coughs, but especially coughs accompanied by wheezing. Sung Bai Pi is for coughs with edema, and Zisuye is good for coughs with stifling sensation in the chest. Kuan and Zawan are often used together because they complement each other. Kuan will stop the cough, while Zawan will help to expel phlegm. Zawan is acrid and dry and is used for cold-induced coughs, while Kuan is cool and moistening. It's better at treating dry coughs. Tilingza not only stops cough, but it reduces accumulation of food or water, and it's especially useful for coughs with copious thick sputum, and it should not be used for coughs from deficiency. Okay, let's talk about some of the secondary indications for the herbs in this category. The two herbs that moisten the large intestine, we have Xingren and Zisuza. The herb that descends stomach qi for nausea, vomiting, hiccups, and belching, Pa Ye. The herb that kills parasites is Bai Bu. It can be used for head and body lice, fleas, bacterial vaginosis, and as a nighttime enema for pinworms. You use it topically for this condition. Herbs that treat hypertension because it works like a diuretic and regulates water and promotes urination is Sang Bai Pi. I just want to do a quick overview of the entire transformed phlegm category. Across all three categories, the herbs that treat phlegm accumulation in the lungs are Chuan Bei Mu, Xing Ren, Zawan, Kuan Dong Hua. If there's more phlegm accumulation in the stomach, then Zhi Ban Sha, Xuan Fu Hua, Pa Ye are better. If you have turbid phlegm obstructing the channels, you can use Konbu, Haitzao, and Zhi Bei Mu. And for turbid phlegm veiling the orifices, you would use Tian Nanxing and Bai Futsa.